Washington hospital officials held a news conference today, and the mood was grim. They say the state is closer to a crisis situation than it's been at any point in the pandemic. King 5's Ted Land is in the newsroom. And Ted, what are the hospitals seeing exactly?
Well, growing numbers of COVID patients and very little room for them. Doctors have a plea for people who are thinking about going to the hospital with COVID symptoms.
Multicare Health System says it's seen a 250% increase in patients with COVID over the past 3 weeks, and its medical centers are seeing their highest ever COVID caseloads in the Puget Sound region.
We are actually attempting to deliver inpatient care in our emergency department spaces because we can't get those patients into our hospital beds.
Evergreen Health says it's seen a 50% increase in COVID cases over the last 3 weeks, and half of their ICU beds are filled with COVID patients. Hospitals across the state are facing similar dire situations as already full medical centers try to take on a wave of new COVID patients.
Many people in the last week or two have received the very bad news that the procedure that they've been waiting for has been canceled or delayed.
Yes, the Omicron variant is less severe, but it's so widespread that even a small percentage of patients needing hospitalization are enough to overwhelm caregivers.
But right now we are closer to crisis situation than we ever have been.
This was a problem they saw coming. Many hospitals have become long-term homes for patients who really should be in nursing homes. But hospitals cannot discharge those patients because of consent laws, as well as staffing issues in long-term care facilities.
Across UW Medicine, we have approximately 200 people who do not need to be in the hospital right now, but we have no place to put them.
While hospital officials urge the state to work out the kinks, they're asking people to think twice before checking into the ER.
If you think you have COVID symptoms and you don't feel great, but you feel kind of fundamentally okay, you can breathe and you feel kind of more or less like you have the flu, stay home. Do not come to the emergency room.
The Hospital Association wants Governor Inslee to issue an emergency order to speed up the discharge of patients who don't belong in hospitals. They also want the state to send strike teams to help with staffing shortages at long-term care facilities to free up more hospital beds for COVID patients and others. Back to you guys.